Breast Cancer Awareness Month here at ABC2, and tonight we have Dr. Young Lee from the MedStar Health Cancer Network, along with Bill Cronin from Chemo Cold Caps. And Cold Caps, we're talking about one of the most difficult facets of the treatment for women is actually losing their hair. Dr. Lee, it makes it seem really, really real.
Absolutely, Kelly. Even though hair loss is not fatal, it is a devastating consequence of chemotherapy. And that's why we're so excited to have a new technology that can help women preserve their hair.
So, Bill, tell us about Chemo Cold Caps.
Chemo Cold Caps enable women to keep, if not all, a significant amount of the hair, most women. What they do is cause vasoconstriction. It's a very cold cap. There's a very cold freezing point below 32 degrees. They're actually chilled in dry ice now down to minus 25 to minus 30 Celsius. So when the cap goes on a patient's head, what it does is it causes the blood vessels in the scalp area to constrict, vasoconstriction, and it impedes the flow of the chemotherapy agents to the hair follicle.
So, Dr. Lee, tell us who's a candidate for one of these.
Actually, most common cancer patients are candidates for this treatment. Only people we would advise against are people with blood cancers like leukemia or lymphoma. But forms of cancers like breast, colon, lung cancer, ovarian cancer, most people can definitely benefit from this treatment.
And have you used it with some patients?
Yes, yes. And
what's the reaction?
About 90% of the time it works great. One patient I treated, she had very thin hair to start with, and she was older, and it didn't work that well. But across the board, there have been many studies that show that 90% of the time it works beautifully to preserve the hair.
And Bill, how long has it been around?
Actually, scalp cooling in various formats has been around since the 70s. However, the efficacy of it has really only improved over the past 10 years. In Europe, this is actually well established. Insurance pays for it. There are devices that you can plug into the wall. Those will eventually make it here to the States. But for now, until those do become FDA approved, you have the gel caps. But really in the past 10 years and almost the last 5 is when they've really taken off in popularity.
All right, Dr. Lee, Bill Cronin, thank you so much for joining us. We're going to be talking about all types of technology and treatment for breast cancer awareness. This is our house calls today at ABC2. The number to give us a call if you have questions is 410-481-2222. We have operators over in Studio B just standing by waiting to take your calls. Jamie?
All right.